Cheers, Carmen. So as Carmen says, I'm Heather Williams. I'm the training lead for the Scottish Women's Budget Group, and I've been working on this project with Karen and an absolutely fantastic group of women from Glasgow Disability Alliance for coming up for about 2 years now. It's been a participative project, so working with the women to identify the work that we were going to do, what we were going to focus on, and how we were going to gather the information. And it's been a really, for me anyway, it's been a really interesting and really fun project to be involved in. In terms of the work that we've done, it's been about looking at how we can use gender budgeting approaches to identify issues for different groups of women are experiencing, and how we can support other civil society organisations to use gender budgeting approaches to take their work forward. And I think the piece of work that we've done with Glasgow Disability Alliance is a good example of this approach. Carmen, do you want to next slide, please? So in terms of gender budgeting, for those, I know I can see from who's here that there's a few people that have been on some of the training that we deliver and will have heard some of this before. But when we think about gender budgeting, I think it's worthwhile as saying, just laying out the groundwork in terms of what gender budgeting does and what it doesn't do. Gender budgeting is about identifying how the way in which we raise money and how we spend money impacts on different groups in society. It's about recognising that men and women's lives are different, often due to care responsibilities, and that means that the way in which we raise money and the way in which we spend money impacts differently on different groups within society. And gender budgeting asks us to take that lens and to ask that question, who benefits and who doesn't. I think it's worthwhile saying it's not about a separate budget for women. It's not even necessarily about extra spending. It's about looking at how we use the money that we raise, looking at how we raise it and how we spend it, and carrying out that analysis to understand how that either addresses inequalities or how it embeds and entrenches the inequality that we have in society. So it's a range of, gender budgeting has a range of tools that allows us to carry out that analysis and to really unpick and to ask that question, how is the way in which we are either delivering this service, so how are we spending this money, how does that impact and help address inequality, or how does it actually reinforce and embed some of that inequality, the structural and systemic inequalities that we have in our society, which are often unseen. As it says on that slide, gender budgeting challenges that assumption that decision making, policy making and budgets are gender neutral. Often we hear people tell us, oh, but that decision that we make affects everybody the same. The reality is that often decisions don't affect everybody the same because we're not all coming from the same starting point. And when we think about men and women in their lives, women are more likely to experience poverty at all points in their lifetimes, because of that gendered nature of care, that expectation that women will carry out caring responsibilities, which impacts on their ability to earn money from paid work. But because care is undervalued and unseen by society, that has implications for those who undertake care-related roles. So gender budgeting is about saying that actually decisions that we take will have different implications on different groups in society. And I suppose an example of that is things like, in terms of the UK, our access to pension entitlement, for example. And obviously that's a big one in the news at the moment, given the changes that are being made in relation to winter fuel payment allowance. A full pension entitlement is based on certain level of national insurance contributions being paid over a certain number of years. which on the face of it seems like, well, that's fine. That's a threshold that everybody has to meet. But when we break that down and we look at the impact that care has on women and women's ability to work and to undertake work of a full-time nature over the course of their lifetime, actually it's a threshold that women are disproportionately less likely able to meet, because they're more likely to be in low-paid work, because the work that is seen as women's work is undervalued and underpaid. But also women are more likely to be working part-time or working flexibly in order to manage those care responsibilities. So that rule that we have, which provides people with access to pensions in later life, is in fact it makes it harder for women, and means it's more likely that women will experience poverty in later life. So gender budgeting is about taking that lens. It's about asking those questions and undertaking that critical analysis of the way in which resources are raised and the way in which resources are spent. And it's about, often, as I say, one of the key things I would say about gender budgeting, it's about really unpicking and understanding and making care visible within our systems and our structures. Care is often, if we go back to traditional economic theory, to Adam Smith's of the world, they seem to think that there was a fairy that went about and did the child rearing, that did the cooking and the cleaning. It was Adam Smith's mother who did most of that for him. But that was very much, those roles and that work was very much invisible within traditional economic theory and our established economic models. And as such, that's carried on through time in the way that our systems and our structures have developed, that care continues to be invisible, it continues to be undervalued, and it continues to be unseen. So much so that when people are not working and paid work in order to carry out care responsibilities, they're classed as being economically inactive. And the reality is none of us are economically inactive. The work that we do, whether it's paid or unpaid, allows the system and the structures that we have to, within society to function. But the basis on which our structures are developed and designed means that care is often unseen. Carmen, next slide, please. Okay, so why gender budgeting? There are a lot of organisations who now say that gender budgeting and gender budgeting approaches are beneficial in terms of growing the economy and developing society. Bastions of feminism such as IMF and the OECD and and the World Bank and things like that are all all kind of behind and talk about the gender budgeting and about that being beneficial for societies as a whole. Because what we know is that when we take that gendered lens, when we collect gender disaggregated data, when we use that information to drive decisions and policy making, that we then design higher quality services for all, that we design out some of those systemic and structural issues which impact adversely on those that are most disadvantaged. It means that we're able to use better able to use the resources that we have, so they're more effective and they're more efficient, because we have a good understanding of the needs of our communities and our citizens, and we're designing services and we're using resources in a way that is effective and meets the needs of those who, as I say, are most disadvantaged. Because if we don't, the impact that has on individuals is devastating, but actually that has a cost for wider society. When we think about some of the big challenges that we have in Scotland in relation to things like homelessness, drug deaths, those kind of big key issues that we're often hearing about, that there are financial costs to organisations in dealing with those, as well as the devastating impact that has on individuals and their families. So gender budgeting and taking these approaches helps us to design systems that better meet better meet people's needs. Because when we don't take that gendered lens, when we don't think about inequality in a way that allows us to really analyse how the way in which we currently do things are impacting on different groups and are creating those inequalities that we see, then actually we are basically going to continue to basically make the same mistakes. And that has as I say, that impact that has on individuals, but as well as the impact that has for our economy is huge. And in terms of, the OECD and other organisations, they're very much clear that if we address gender inequality, then both men and women are better off, but also that is a factor for economic success and for growing the economy. And given where we are in Scotland and the challenges that we have around our population, with an ageing population, and as much as the recent figures show that Scotland's population has increased recently, we still have major challenges because that increase was due to migration as opposed to necessarily in relation to growing birth rates. So there are major issues that we have to tackle, that if we're not tackling them and we're not designing them with that gendered lens and thinking about how the way in which we raise money and how we spend money impacts differently on different groups and tries to, as I say, eradicate some of those inequalities and those structural issues, then actually we are missing out on, we're making it harder for us to tackle some of the major issues that we're looking to tackle. Carmen, next slide, please. Okay, thank you. So there are some kind of key principles in relation to gender budget, and I'm only going to cover a couple of them in the time that we have this morning. But in relation to, I suppose, a couple of them that stand out for me, which I think are really, really, all of these are important, but in terms of when we're thinking about gender budgeting and the approach and the way in which it asks us to analyse and to ask questions about the decisions that we're making, there are a few that really stand out, I think, which are really important in terms of where we are at the moment and being able to address some of the major issues that we have within in Scotland if we're going to challenge poverty. Gender budgeting is about is performance and results orientated. So basically, it's an outcome focused approach, and that's about basically linking the way in which we raise revenue and the way in which we spend money to what we are trying to achieve. It's about being really clear about these are the outcomes, this is what we're trying to do, and this is how the decisions that we are taking around how we're raising money and how we're spending money are linked to that. So it's about being really, really clear about these are our priorities, this is what we're wanting to do, and this is how the decisions that we're making around spend and revenue raising and how they tie in with that. Within Scotland, we have the National Performance Framework and the outcomes associated with that, and that's currently they're currently being reviewed. Carmen was given evidence to the Finance and Public Administration Committee on that last week. That's a framework that sets out what we want to achieve in Scotland, but rarely is it actually used to direct the spending either at Scottish Government level or at local government level or by other public bodies. And when you unpick in terms of the work of local authorities or the Scottish Government or other public bodies, the decisions that they take are at budget time often have little relevance or have little link to their strategic plans in terms of what their strategic priorities are, or in relation to their equality outcome plans. So often spend and equalities, spend and our priorities are there's a missing thread, there's a missing link often. So gender budgeting is an approach that can really help us to link the things that we're doing in relation to how we raise money and how we spend money to what it is we're actually trying to achieve, to our outcomes, basically. It takes an intersectional approach. While we start off with looking at the impact on men and women, it's very much about recognising how those other characteristics that people have can impact on their lives as well. So whether that be disability, race, ethnicity, class, socioeconomic status, it's about taking that intersectional approach wherever possible, and about trying to make sure that the data that we have, the data that we gather, and the data that we use is disaggregated, and we really understand who it is we're talking about when we're taking decisions, that we understand we see the people within our decision making. I've mentioned about that gender budgeting is about taking account of the effects on the unpaid care economy. So it's about bringing that front and centre. It's about making sure that we see care and that we understand that when we make decisions, whether it be about changes to school transport or school crossing patrols, that has a real impact on the lives of often mothers who will then be responsible to take children to school, which then has an impact on their ability to get to work on time. So it's about really making unpaid care visible. And thinking through the cumulative effect. So if we do this, what impact is that going to have on those who need to get children to school? What does that mean for their ability to work? How does that tie in with public transport? All of these things. Gender budgeting is very much about trying to take that holistic approach and move out our silos that we often operate within, particularly within the public sector in Scotland. Gender budgeting encourages us to look at the cumulative impact of the changes that we're making, or about really thinking about how a decision in one area impacts on other areas and on people's lives. People often tell us, that they don't live their lives in the silos that public sectors are designed, that the public sector designs its services around. Gender budgeting really encourages us to think about, if we do this, what does that mean over the life course for individuals, but also what does it mean in terms of other impacts on other areas, and how do we make that visible, and really kind of think about, actually, does this change, is it likely to have the impact that we think it is going to have? Is the spend, is the saving measure, is the way in which we're raising this money actually going to bring in the money that we think, and save the money that we think it is? And I think the work that we've done with GDA is a really good example, particularly around social care charges, of being able to show that actually sometimes the way in which we're doing things, particularly around revenue raising, often doesn't necessarily have the savings or the income generation that we think it does, and potentially costs more in the long run for the individuals involved, but also for services and organisations. So I'm going to hand over to Karen now, who's going to tell you a little bit more about the work that we've been doing together and what we've...
Oh, thank you, Heather. Thank you. Yes, we had first got in touch, I think, with the Scottish Women's Budget Group. They got in touch with us back in 2022 on the back of a report that we had done, which was the Triple Whammy report. And that was looking at the impact of being disabled, being a woman, and the impact of COVID. Now, this was actually a piece of work that we had started back in February, I think it was 2020, which is obviously before kind of COVID really, the lockdown, which happened then in, I think it was March, April of 2020. So we'd started doing this work with groups of women, doing kind of face-to-face workshops and so on, which then had to all kind of shift online. And obviously then the impact, it was looking at the impact of being a disabled woman, and then the impact of COVID really started to hit, and so this then filtered through the whole research. So just to go through kind of some of the key themes that came up through the Triple Whammy report was the impact of access to healthcare, for instance, with a lot of appointments just suddenly stopping, particularly appointments that were maybe more kind of public health preventative screening screening issues. So that obviously missed a lot of opportunities for prevention and early intervention in women's healthcare, which then meant that conditions deteriorated and were then much harder to deal with. It was more problematic to deal with when appointments did start up again. So lots of issues around healthcare, particularly also around social care, whether that was with individuals' packages being stopped, so carers no longer were not coming into people's houses, that having an enormous impact. But then also often it was women that then stepped in and had to kind of like, take on the care that had stopped. And so again, we saw that was a really kind of like gendered impact on how that affected the women. And also to tie in like with what Heather was saying, at GDA, we were always kind of working in a very intersectional approach as well. So on the triple whammy report, when we were doing that with the workshops and the focus groups, we've also got our disabled BAME network. We have our LGBT network. We talk to older women, younger women. So we got a really good picture across what was going on for female members of GDA during the lockdown. And as I say, then on the back of the triple whammy report, we began working with the Scottish Women's Budget Group. So can I have the next slide, please? So we began kind of basically doing a lot of kind of capacity building to begin with. At GDA, we were a community development organisation, so we use really kind of highly participative approaches. So we got kind of essentially kind of a core group of women who were really there from the very start, and then we've had other kind of women join in at different activities and events and so on. But to begin with, as I say, we had to do the kind of capacity building. So Heather had come in and done a lot about some of the initial workshops were very kind of general about sort of like gender stereotypes, beginning to think about how being a woman had impacted on the people taking part, the different kind of roles and expectations that they were coming up against. So once we'd kind of done that basic capacity building, we then began to kind of think more deeply about what if we were going to do a project like this, what would the women want to focus on? And over a few sessions, we decided that what was really coming up was a lot about the cost of living and how that was beginning to really have an impact on people. So we used lots of different kind of methods. We had as you can see here, these are some of kind of like the art and collage that some of the women created when they were really kind of thinking about the care, where they were having to kind of cut back on things with the cost of living. We had facilitated discussions, we had workshops and speakers. So just kind of like had lots of different activities going on. And what then came out of this was that we created, along with the women, a survey that was asking, which we put out to all our members, their women members, asking them about how the cost of living crisis was impacting on them. And that survey was up from May to July of 2022. And if we can have the next slide, we can see some of the things that was coming out of this. So we'd asked people about particular kind of access to resources and services. And we were asking, like, if people were able to manage these costs and so on. So from our survey at this point, we found out that people they were either not managing to meet a lot of these costs or could only meet costs by cutting back elsewhere. And so, for instance, we can see here, like kind of like food costs, pretty much like 93% of people were only managing by cutting back if they cut back elsewhere. And so a lot of in all the cases here, it really was showing that people were not managing and were not able to just meet the costs in the way that they had been. So as well as kind of like wanting to know how people were managing with the costs, what was really important to us was we wanted to kind of know about the impact as well. And what came out through here as well, just to say, is that in some of the cases, from some of the comments that were left in the survey, people were saying that they were struggling to manage the cost, they were kind of having to cut back elsewhere, but at some point they just got to a point where things couldn't get cut back any further. So we had a lot of people talking, for instance, particularly around energy costs, for instance, saying that, that got to the point where they'd already turned off their heating. They were really limiting what they were cooking, how often they were like heating up food and so on. So they'd cut right back to the bone. we're still really struggling to manage these costs. So in fact, people were saying things like, well, they just ended up going back to bed because it was warmer. They were at least under their blankets there. And that was kind of the ways that they were trying to kind of mitigate what was going on. So if we can have the next slide, we can see some more of the impacts that, and what we had found. So one of the things that came up very strongly was about the additional costs that the additional cost of being disabled. And a lot of these costs are things that, we don't even really think about until people are having to deal with them themselves. So these can be, for instance, things like if because of a health condition you have a special diet that you, and perhaps the food for that to meet that diet is more expensive. Or if your social care has been cut back to the point where you're not getting support to come in and help make meals, then you end up relying on microwave meals, pre-prepared meals, takeaways. So things that are generally more expensive, but then also things that probably are not as healthy as well. So again, that can have an impact. A lot of the women were having to use having much higher energy costs. Perhaps that was because having a long-term condition where people have to have the heating on longer, if it's to reduce pain levels or so on. Having to charge essential equipment, perhaps power chairs if you've got a mechanical hoist or a hospital bed, nebulizers, things like that. Having to power chairs. These are all things that are expensive to charge, but they're absolutely essential for living. And things also like perhaps having to do washing more regularly, having to do laundry because you may have continence issues. Just so things like that, having to a lot more energy costs. Also transport costs. Public transport a lot of the times is still not accessible to disabled people. So people have to rely on taxis more often, and we know they are getting more and more expensive. And then also social care costs. And obviously we're going to be talking about this in more depth, but this is really a backdoor tax that only disabled people are having to pay. And for instance, in Glasgow here, where we're based, it was since 2023, it was decided that the Glasgow City Council can take up to 75% of people's disposable income, so income after housing costs, to help cover their care costs. So this is something, that is really having a huge impact. So these are all things about the hidden costs of disability. And there's research that's done every year by the organisation Scope, and their most recent report just came out earlier this month. And they have what they call the disability price tag. And according to Scope, the most current figures are that disabled households need an average of £975 a month more to have the same standard of living as non-disabled households. So that's a huge cost, and obviously that's something that is really having an impact as well. So as well as the additional costs of being disabled, also services that perhaps didn't come back to the way that they had been pre-pandemic. So we had women talking about if their service had been cut, or perhaps in a couple of cases, women who were so anxious about carers coming in, knowing that they'd be going to lots of different houses and so on, and dealing with lots of different care users. They were anxious about having people coming in because they were perhaps, even if not on the shielding list, would be more vulnerable to getting infections, to getting COVID. So they had perhaps asked for their care to be postponed. And although some had been assured that would then, once they were more comfortable with having people coming back into their houses, then it would just be reinstated. In fact, people were then having to go through a reassessment and so on. So care either not being brought back as normal, or a kind of an extra hurdle almost to that having to be to being reinstated. As we say, we could see some of the things that women were doing, which were really having an impact on their health and well-being. So whether it was kind of like having to cut back on their heating and so on, which might then exacerbate a condition that they had and so on. So we're finding that also a lot of women were just kind of talking as well about kind of how their lives were getting kind of smaller in a sense. So if we can go on to the next slide, that people were really just kind of having to kind of like they were just surviving. They weren't really talking about like having a life, and just having to cut back on so many other things, whether that was going out to see friends and family, or going to community groups and so on. So we can see that 74% of the women in our survey had said that it affected their mental health, 56% that it had affected their physical health, And then as a knock-on from this, 24% were having to go and see their doctor more. So that ties in with what Heather was saying, that where things were cut back, it's not necessarily making, it might be making an immediate saving, but then it's having a longer term impact and costing more in the end. And then 22% were saying because perhaps of having to cut back on food and special diets and so on, that had a real impact on their ability to take their medication. If people were having to take medication with particular foods, then that again was making health conditions worse and so on. So we can see that this was having like real kind of real impact on the different women. And there's just some of the quotes that were here saying people just staying in bed because it was where it was warm and they couldn't afford to put their heating on, that they were missing people, feeling more isolated and lonely. So these were the main findings. And also just on this as well to say that so I should have said when we were talking about the additional costs of the hidden costs and the additional costs of being disabled, that obviously a lot of the women in the survey are on non-means tested disability benefits. So for instance, adult disability payment or PIP. And these are things that are meant to kind of cover the additional costs of being disabled. But what we've been hearing more and more, especially since since this survey, is that more people are just finding that that's essentially just the disability benefits that are meant to cover the additional costs are essentially just more kind of going into the household pot, and more they're actually just covering everyday essentials, and that these aren't things that are covering the extra heating, the extra transport and so on that they're meant to. And in fact, the Joseph Rowntree Foundation, which has just issued earlier this week its Poverty in Scotland 2024 report, the focus this year of that report is on social security and how that's kind of like addressing or not poverty in Scotland. And one of the kind of really shocking things that is in that report is that where someone is disabled, they're 3 times as likely to experience the combined low income. So that's less than 60%, below 60% of the median income, and material deprivation. Disabled people are 3 times as likely to not be able to access the key goods and services. And that really reflects what we found in the survey that we did with the women back there. So what we then did with all this information, if we can have the next slide, please. We put together a briefing paper because we knew at this point that this was November 2023, and Glasgow City Council were at that point all in their negotiations about what the budget would be for the following year. So we wanted to kind of use the information that we'd gathered from the women and like really get it into the hands of the people that were going to be setting this budget and kind of seeing what was going on with it. So Heather and I and some of the women who had from the core group, we invited the councillors. We sent the briefing paper to all of the MSPs and Glasgow City councillors. We invited the councillors to come to a round table to hear directly from the women what their experiences were and what they were kind of wanting them to be thinking about when they were going into when they were thinking about setting the budget for the following year. We did get some traction from that meeting. It was encouraging that a couple of councillors then did submit questions and so on to be asked about using the information from the briefing paper. And at that point, we'd also were getting more and more concerned about what was happening with the Glasgow IJB, with the Integrated Joint Board, hearing where they were going to be making real swinging cuts to the social care budget and how that was going to impact. So at that point, using all the information we'd already gathered, we began to then focus more about specifically looking at social care charges. And so at that point, I'm going to pass back to Heather to tell you what we found out about that.
Brilliant. Cheers, Carmen. Cheers, Karen, I should say. Sorry, I'm all over the place. Carmen, next slide, please. Okay, brilliant. So one of the things that we were looking at as part of this project was to see how, I mentioned at the beginning, was to see how we could use gender budgeting approaches to support other civil society organisations in the work that they do. So in relation to the work that we did with Glasgow Disability Alliance and the project with the women members that have worked with us, we use a couple of approaches. Gender budgeting has a range of tools. Most of them have got fairly, I would say, kind of academic names, so beneficiary analysis, gender disaggregated, this, that, and the next thing. So we've kind of tried to make it understandable in terms of what these tools actually are and how you use them. So the beneficiary analysis is about actually asking those affected how policies or decisions are impacting on them. So we carried this out with the work with GDA in a number of ways. So the survey that we carried out, the workshops that we carried out with GDA members, and as Karen said, one of the things that they identified through that was about the social care charges, how that was an issue for them in relation to the impact that the cost of the increase from having to pay a 50% contribution to 75%, the impact that was having on their ability to manage other everyday household expenses, and how the process in terms of the assessment that was carried out was impacting on them as well. So that initial starting point was the beneficiary analysis, which identified that there are some, we would say, key issues with this policy. As Karen says, it's a tax on disabled people. Now, the Scottish Government have committed in theory to doing away with social care charges in recognition that this is a tax on disabled people. But as of yet, there has been no funding provided to actually make that a reality. What the work that we carried out with Glasgow Disability Alliance showed was that the way in which this policy is currently being implemented across Scotland. So while this project focused on Glasgow Disability, Glasgow and the members that GDA have, these policies are being implemented across all local authority and all integrated joint board areas in Scotland, to different degrees in terms of the level of payment that individuals are expected to make. But most local authority and most integrated joint board areas will have some kind of policy, some kind of charging in relation to non-residential social care charges. So that initial work, which is within gender budgeting terms would be called a beneficiary analysis, identified the social care charges as an issue. We then looked at what did the data tell us, and we tried to follow the money. So gender budgeting is very much, it's data-based. It's about looking at what data we have, what do we know, what does that data tell us, what does that tell us about how the way in which we currently do things are impacting on different groups. So wherever possible, that the data that we use is disaggregated, and we get a really good picture of the people that we're talking about. Now, in relation to social care, what we know is that women are more likely to access social care in Glasgow, and that's similarly across the rest of Scotland. So they're more likely to be users of social care, as well as more likely to be the ones who are working within social care. But also we know that often women who are using social care, that disproportionately more likely to live alone or live with children. So the data, that was there already led us to believe that there were some gender differences in relation to this. We then looked at the policy documentation and the equality impact assessment for the policy change that Glasgow made, to say that the equality impact assessment was lacking I think is being kind. Actually, the equality impact assessment was not of equality that I think should be expected when we are making changes which have such an effect on a group within our society that we already recognise and know are disadvantaged. And in fact, at a recent judicial review that was carried out, the EQIA, the finding was that the equality impact assessment wasn't of a robust enough quality in relation to that policy change. So we reviewed that, had a look at what they were saying, what was the data that we're using, what was the information. And it was really difficult within that to actually recognise, to see how many people they thought this change was going to impact, how they thought that change was going to impact on them. So the data that was used in relation to the policy documentation and the equality impact assessment was pretty invisible. So one of the things for us that we would say is that we need to make sure that when we are working within, when we're making any changes to policy, when we're developing new policy, when we are developing equal impact assessments or integrated impact assessments, is that actually we show our workings. What are the numbers? How many who do we think is going to be affected by this? Who are those people? What does that look like? So that was very much missing from the Glasgow documentation that we looked at. So we then followed that up with a freedom of information request to try and identify whether an equality impact assessment had been carried out around some of the specific decisions that had been made around the policy that had been developed, so particularly around income thresholds, because one of the things, and Karen mentioned the Joseph Rowntree Foundation report, one of the things that they were saying is that actually the thresholds at which individuals start to pay these charges are at such a low level that it doesn't allow individuals to cover their basic expenses. And that was one of the things that we found when we looked at the Glasgow policy, is that basically for a single person under 60, they started paying back if they had an income of just over £8,000 a year. Now, in all metrics, that is someone who is living in poverty. You know, whether you're whatever metric you're using to measure poverty levels, that is someone who is experiencing poverty. That's accepted, I think, on all metrics. But that was the level that Glasgow are using. That is the level that is in the COSLA recommended guidance for local authorities around this. And that for us is an issue that is problematic in relation to how this policy impacts on disabled households, and particularly how this policy interlinks with our supposed priority of addressing child poverty and recognising that disabled households are one of the 6 key target groups. So through that FOI, we asked for what assessment had been carried out in relation to choosing that income threshold, and you'll be surprised to know there wasn't one, because it was based on the COSLA guidance. We asked for information on how many people had, since this process had, since the policy had been implemented, how many people had refused care or had stopped receiving care as a result of the charges. The system doesn't allow them to provide that information. And we asked for the number of assessments, financial assessments that had been carried out from the April since the new policy was implemented and September, and how many disability-related expenditure assessments had been carried out, because that was one of the mitigations that had been identified in the equality impact assessment. And the numbers on those were quite surprising. Carmen, next slide, please. So in relation to the FOI, basically they were unable to provide us with information on the numbers who refused or stopped receiving care due to the policy change, because their systems don't allow them to track that. From the April to September, there had been 1,591 new assessments carried out. I'm going to put this out to you in terms of how many disability-related expenditure assessments do you think were carried out on those 1,591 assessments? Any guesses? You can either take yourself off mute and suggest, or put it in the chat in terms of what do you think? 5? Wee bit higher than that, Suzanne? but not much. Helen, 91, slightly less. Anybody else want to have a wee guess? Ruth, 50, closer. Maria, 11, Colette, 45, 22. So there were 22 assessments for disability-related expenditure carried out in that period. And of those, only 6 were for women. Now, given what we were saying about the data, which shows that women are more likely to be in receipt of social care, when we looked at the data for those nearly 1,600 assessments, the majority of them were for women. So the fact that only that such a small number of women were assessed for disability-related expenditure raises some concerns about the way in which that policy is actually being developed in practice. And what we found was that there was a lack of public information on the disability-related expenditure and how this was used. So that was what some of the information from the FOI. In relation to the equal impact assessment, and I've covered this a little bit, but I just want to say for us, one of the things is that the Glasgow equal impact assessment in relation to this, but I would say this is not just a Glasgow issue. When we look at equality impact assessments in relation to budget proposals, either in terms of the work that we do with councils, but also in terms of the work that we do reviewing Scottish Government and local authority budgets, one of the things that I would say is that disaggregated data is people are often missing in equality impact assessments. We don't show our workings, we don't use disaggregated data. I think, Karen mentioned, and there's another good example of it, Karen mentioned the changes that are happening, or the proposed changes that are happening within Glasgow Integrated Joint Board at the moment in relation to changes in relation to the criteria as to who can access social care, and whether that social care will be in someone's home or in another setting. And the paperwork for that doesn't show the working. So it doesn't show how many people they think are going to be affected by these new criteria, by these decisions that they're making. Or whether there is capacity within within residential care to meet the numbers that they think potentially could be affected by this. So time and time again, when we look at impact assessments, numbers are missing, people are missing, we don't show our working. And the recent Audit Scotland report into the Renfrewshire school issue, where the school was built too small, highlights the need for us to show our working. I always go back to, showing my age here potentially, but I always go back to maths classes. How often were we told, show your working, you get points for showing your working? And it's important that we show our working and have that those numbers are clear, so that actually people can say, actually, you sure that's right? Because let's face it, Excel's no perfect. We can all make a mistake when we're kind of calculating things. So it's important to show our working, that we use disaggregated data and that it's present. We would also say in relation to impact assessments that we need to just stop admiring the problem. Often when we look at them, and the Glasgow one was no different, is that it gives us all this evidence, it cites all these reports. No doubt next year when we look at impact assessments, they'll be citing the Joseph Rowntree Foundation report that Karen spoke about. But what we don't do is don't join the dots. We don't look at, well, actually, what does that evidence tell us about what we're trying to do? How will that impact on what we're trying to do? Or how will what we're trying to do impact on the evidence that we have around inequalities? We don't carry out the analysis. All we do is we say, these are the reports. Those are something that is really important in relation to impact assessing and how we use that. And the other thing is that there needs to be the ability to follow up and identify the impact of the policy. So the question we asked about how many people have stopped receiving care or refused care because of these charges, nobody's able to answer that question because our systems aren't set up to capture that data. And we often find that within the quality impact assessment process is that we often think that we only have to assess the initial decision. Actually, the guidance tells us that we also need to follow that up. An impact assessment is not just one and done. We need to make sure we're following up and able to identify the impact or any unintended consequences that come from from our decisions. So the data, again, is really important in that. What is it we're changing? What is it? What do we need to measure to be able to identify any impact that that policy has? And that's important in terms of when we're thinking about impact assessing in relation to this as well. And all of this, I suppose, in this work led us to the COSLA guidance. And this guidance, which suggests that DWP level, income levels should be used as thresholds, which has no linkage to child poverty agenda, so that lack of policy coherence, and that there are issues in relation to disability related expenditure and how that is identified and addressed. So we have ourselves in GD have been speaking to COSLA and have made some suggestions as to how that policy could be amended. Obviously, both organisations are completely behind the scrapping of these charges, but we recognise that until the funding's available for that, that's not going to happen in the short term. So we're looking at how we can help, I suppose, our public authorities to improve this policy and to join up some of those dots potentially. Because, well, on the face of it, social care charges bring in money to the health and social care system. Actually, what we are finding is because of or what we think we've been able to show is that because of the level that they're set at, the way that the system operates, is that actually potentially there are additional costs that the system are having to deal with because of the impact of these, because of the changes that people are having to make to be able to manage these costs, or because they're having to say, actually, I can't afford those costs. So that's just a little bit in terms of where we've got to with this work, but just to say it is continuing. So Carmen, next slide, please. So I suppose really just that this is just an overview of some of the work that we've done. And the recommendations that we have made or we suggested to Glasgow that they may want to consider in relation to how this policy works at a Glasgow level. But we would also suggest that this might be something that other integrate joint boards and local authorities may want to look at in relation to how their policy works as well, as continuing the work with COSLA to try and amend the guidance. So really just before we move on, just I suppose any questions. So next slide, Carmen, yeah, if anyone's got any questions that they want to ask at this point.